Well, good afternoon, everybody. So I want to talk today, not starting off by talking about COVID-19, as we usually do, but about the flu. While the flu can be deadly on its own, we are also certainly concerned with Ohioans who get both the flu and COVID-19 at the same time. Doctors tell us this could be very, very dangerous. A flu season will be upon us certainly very soon, and anyone can get vaccinated against the flu. Anybody who can should do so. The First Lady and I will be getting vaccinated today, and then the Lieutenant Governor will be getting vaccinated in Columbus. We certainly encourage everyone who can to get vaccinated as soon as possible. The Centers for Disease Control and Prevention advises that anyone who can and is 6 months or older get vaccinated against the flu. This includes pregnant women whose vaccinations can protect their babies in the time after birth. Our youngest and oldest Ohioans, those who are pregnant, those in long-term care facilities, those with chronic health conditions, may be especially susceptible to severe illness or complications from the flu. It's extremely important to get vaccinated also if you're an essential worker. People 65 years and older are at the highest risk for flu-related deaths. They have a poorer immune responses to flu vaccines than younger people. And for adults of this age, they should get a high dose. If you're elderly and need help getting to your physician or a location that offers flu shots, we encourage older Ohioans to contact their local area agency on aging at 866-243-5678. Area agency on aging at 866-243-5678. They can connect you with resources in your area for transportation and for other services. Children younger than 5, and especially those younger than 2, are at a high risk of developing serious flu-related complications. Some children between the age of 6 months and 8 years should receive 2 doses of vaccines for adequate protection. Now, this is the case for children of this age who are getting vaccinated for the first time and those who have only previously gotten 1 dose of vaccine. Obviously, talk to your pediatrician, your local physician, to learn whether your child should get the 2-dose regimen or not. Many Ohioans may be accustomed to getting their annual flu vaccine in the workplace. We know with many people working from home, maybe that will not be possible this year. But there are still ample locations for getting vaccinated: local health departments, healthcare locations, pharmacies across the state. If you don't have a primary healthcare provider and don't know where to get a vaccine, visit Vaccine Finder. That's vaccinefinder.org. Fran, I want to thank today our primary care physician, our friend, Dr. Kevin Sherritt from the Kettering Health Network. We thank him for making a house call today. So Kevin, thank you very, very much for coming. And Fran and I will get a shot.
Right up here.
All right.
Okay. All right. Where do you want it?
You're the doctor.
Yeah.
Where do you say?
There we go.
Hold that.
Yep, we're good right there. Just
Got
let
it?
your arm relax.
All right.
There we go. Okay.
Yep.
Put a Band-Aid on here so we have a problem with your white shirt. Good.
Thanks,
Doing
Kevin.
great.
Thank you very
You're
much.
welcome.
Fran, let you slip over there.
Make it easy.
Fran, you came better prepared.
Yes, she did. No adjustment there.
You didn't even flinch.
She's tough.
That's tough.
She's tough.
There you go.
All right, Dr. Sherritt, thank you
You're
very,
welcome.
very much. And we'll now go to Columbus for Jon Husted. John?
Hi, Governor. We're going to get going here. Catherine Joseph is the nurse and runs the immunization program manager here at Columbus Public Health. So she's going to give me a shot. It's also worth noting that, while it's important that we get the flu shot so we don't get the flu, we're also trying to free up that supply chain for when, hopefully, the vaccine is available for the coronavirus. So it's really important that we do that so that the refrigeration is available, so that people like Catherine who provide the immunizations or vaccinations, I should say, are there and ready to and able to help us.
All done.
All right. Thank you, Governor. We're ready to go.
All right. Thank you very much. Well, you may have noticed today, Fran, I have orange on. This is in honor of Hunger Action Month. Today is also Hunger Action Day, where we're encouraged to get connected to volunteer opportunities, to donate, and really to raise awareness about the problem of hunger. I'm proud of the members of our Ohio National Guard who have really stepped up and who have served many, many missions supporting our food banks and food distribution centers across the state of Ohio. Their work kept many of these facilities, or helped keep many of these facilities going, and we appreciate that very fine work. To help the Ohio Association of Food Banks is recruiting 25 full-time AmeriCorps Vista National Service individuals as part of a new program to respond to COVID-19's impact on our food security. Ohio is one of 4 states selected to participate in this pilot. To learn more, and if anyone wants to apply, or you know of anyone who wants to apply, visit ohiofoodbanks.org/recruitment. Now I'm going to turn it over to Fran. Fran.
And so I'm happy to be helping on this Hunger Action Day because it's so important. Nutrition plays such a big part in our lives, in our old people and especially in our children. And that's why these food banks are such a vital part of our resource of our communities. Over the past 7 months, Ohio's food banks have been finding really creative solutions to continue providing healthy food to anyone in need, no questions asked. I encourage everyone to check out the website www.ohiofoodbanks.org/coronavirus, and you'll find ways that you can help and get help. Our schools have been doing an incredible job. They're providing free meals both to kids that are in-person learning and remote learning. This is through the end of December 31st of this year. They distribute meals to remote learners, such as community pickup locations, home delivery, and bus stop drop-offs. They offer multi-day meal packs with breakfast and lunches for multiple days to save families both time and travel, and provide meal service including weekends and holidays. So these are just such important things. So, it's also a time, it's a day when you can think about, if you need help, you can get help, and how you can help. And I think, whether you're a public citizen and want to contribute to the food banks, or if you are a corporation and want to contribute, even one of our grandsons did an Eagle Scout project that even helped with that, with their local food bank. So it's a day to really think about that and to realize this is a resource for everyone, and I hope if you need it, you'll take advantage of it. Thank you.
Thanks, Fran. I think we all know all the things that this coronavirus have caused, and certainly food insecurity is something that we have to deal with, and there are people out there who really need the food. So as Fran says, if you can donate, if you can help, if you can volunteer, that would be great. We are all in this together, and one of the great things the last 6 months has been to see Ohioans just really pulling together. Let's go to the slides. Eric, we'll start with our regular data slide. We look at the number of cases, 1121. What we know, of course, is during the weekend, particularly a holiday weekend, these numbers were down. They're back up now, 1,100. Deaths, and I would just remind people, because we have questions about the deaths, and people look at these numbers, and with the deaths, what we're doing is simply reporting the number that we have reported that day. Then for the full data, it may have been 5 days ago, 10 days ago. Those are slotted in for those days. But the number you're seeing here is what has been reported in that last 24 hours. So Eric, let's take a look at the next one. Well, this is, an advisory, and we put this up only as an advisory. We do it once a week. We do it on Wednesday. It is posted, and what you'll see on here are the states that we, advise that if you're going to be traveling to, just understand that the positivity rate is particularly high. All these are actually 18, with the exception of North Dakota, that is at 19 positivity. That is a high positivity. So the advisory is for leisure and business travel. We ask that it be followed by Ohioans and out-of-state travelers. This week, 4 states have a positivity rate of 15% or higher: North Dakota, South Dakota, Kansas, and Alabama. So again, we just advise people, if you're going, understand that that's a high rate. As we discussed, it's not always just about where you're going. That's part of it, but it's also about what you do when you were there. Okay, let's look at, Eric, the case numbers by age. This is a slide that our team has put together, and it starts off in March, and you see percentage of cases, and then into September. And as you can see, as far as cases, this first group, 0 to 19 is the first line, and 20 to 29. So if you look at in September, now we're in a partial month. We don't obviously have the full data for September. We're a long way from that. But if you just look at the days so far in September, significant number of cases, 56 or so cases, that are between the age of 0 and 29 as a percentage. So again, these numbers, if you look at August, which is a complete month, which is probably a better month to look at, 0 to 19, it's 16% the cases made up of that group of people, 22% the age of 20 to 29. So again, these are going up. They've kind of stabilized now. But again, it's just interesting to see where these cases are. Eric, you want to pull the next slide? This is hospitalization by age group. So you take each age group and what you look at is the percentage of those people who got COVID, who tested positive, those people who got COVID, how many of them ended up in the hospital? And so no real surprise. One caution, this is not 100%. This is only up to 30%. So, obviously the top groups that end up in the hospital are the older individuals, but also note the youngest. So the youngest 5%, 0 to 4, 5% of them ended up in a hospital, and up to 30, a little bit better than 30% in the 80 to down to 70. So again, no huge surprises, sort of the things we've been saying, but this is Ohio data, and this tells you kind of what we are seeing in Ohio. Eric, let's go to the county color update. And a lot of this is stabilized, for good or bad. 68 of our counties stay at the same level this week. 9 counties dropped from orange to yellow, so more yellow counties. We like that a lot. Great improvement. Lucas County, Wayne County dropped from red to orange. Again, we're happy about that. We have 6 red counties, tier 3. That's down from 7 last week. This week's red counties: Butler, Mercer, Montgomery, Preble, Putnam, and Summit County. 2 of these 6 counties, Mercer and Preble, only meet the CDC's threshold for high incidence, but because they were already there, they stay there. We'll talk more about those in just a moment. Let's talk now about the red counties. Let's start with Putnam County. Putnam County is at a high level of cases, 280 cases per 100,000 population. Putnam County has had 95 cases during the past 2 weeks. The county's total since the beginning of the pandemic is 430 cases. So you can see they're getting a lot of them in a rush. County is seeing a sustained increase in new cases, growing from an average of 5 cases per day on August 19th to an average of 11 cases on August 29th. Primary source of spread in Putnam County is within families. For example, mom gets it and then comes home and gives it to other family members, or dad gets it, or child gets it, but it's in families, basically spread within the community. Let's go down to Butler County. Butler County's numbers certainly are still being influenced by what's going on at Miami University. Between September 2nd between September 2nd and 8th, there were 545 student positive cases. The previous week, there were 495 cases. These numbers are certainly impacting the county's sustained increase in new cases. In addition to the Miami University student cases, there are small outbreaks at workplaces and long-term care facilities. Let's go up Northwest Ohio to Mercer County. Mercer County continues as red because they meet the CDC's threshold for high incidence. Their number is 206 cases per 100,000. Their per case number sadly increased this past week from 179 last week to 206 this week. So we'd seen it coming down for Mercer County for a couple of weeks. Now we're seeing it starting to go back up, still at a very high level. Mercer County continues to see spread throughout the community. They've had outbreaks in workplaces, they've had long-term care facilities, and they've got just pretty much spread throughout the county. Montgomery County, one of our more urban counties. While during the total 2-week reporting period, Montgomery County had a sustained increase in new cases, the county is seeing a decline in cases during the most recent week of reporting. Remember, we look at 2 weeks always. So the last week has been better. We're seeing a lowering of cases coming out of the University of Dayton. During the past 3 days, they only had 31 cases. They have a total of 962 total recovered cases, so 962 recovered. UD has shifted their classes to remote through September 14th to slow the spread. In addition to the University of Dayton student cases, there continues to be small workplace spread and long-term care facility outbreaks as well. Over west there to Preble County, their case number is 105. So if they can get below 105 for a 2-week period, we hope that next week they will drop below the red. Preble County's cases have decreased during the past 3 weeks from an average of 146 cases to 122. The county is ending the past 2 weeks at an average of 105 cases. If the county continues on this trajectory, it should drop from red to orange next week. So again, most important part, they're moving in the right direction, and we hope that Preble can get that below 100 and move off the red. Summit County, seeing a sustained increase, sadly, in emergency department visits for COVID-like illness. That is an early warning sign. On August 20th, the county had an average of 5 visits per day to the emergency department. That number increased to an average of 9 visits per day by August 27th. The county also seeing a sustained increase in hospitalizations. Admission numbers have increased from 2 admissions on August 22nd to 7 on August 29th. Outbreaks have been associated with workplaces and a fraternal club. I want to take a minute and talk about the fraternal club outbreak. We're certainly not going to identify it, but like many of the clubs that are found throughout our state, nonprofit, has a restaurant, has a bar. In this case, 2 people visited the club while they were contagious. Since then, employees, other members, and family members got the virus. No indication, obviously, that these people who came knew that they were contagious. People don't most of the time know that. It's, at least a lot of the time, they don't know that. So again, 2 people came, they visited, and then we saw other members and family members get the virus. A total of 12 people tested positive. Only one of the people was with symptoms. The cases range in age from 29 to 81, and 4 people have been hospitalized, 2 are seriously ill. Look, we don't share these stories to make people feel bad. This is just a horrible, horrible situation. I don't think anyone wanted to make anyone sick. None of us want to make anyone sick, but the story just illustrates how this can happen in what would appear to be a very benign, friendly situation. So we just ask people to wear masks, keep the social distance, and do all the things that everyone talks about in the health community. Let's go, Eric, to our top 10 counties. Again, what this represents, and this is the top 10. You can see on our webpage the top 88. We'll stay, Eric, just with the top 10. These are counties that, no matter what their color, meet the CDC's threshold of what they call high incidence, which means over 100 cases per 100,000 over a 2-week period of time. A county is flagged as high incidence when it has more than 100 cases per 100,000 residents over the past 2 weeks. CDC uses this as a definition of high incidence. Why do we worry about these counties? Well, it means that cases are rising steadily in a county. Even if that county doesn't meet one of our other indicators, they have a significant number of cases. Having a large number of cases can lead to rapid virus transmission throughout the county if steps aren't taken to slow the spread. 4 counties moved to a high incidence list this week, and I want to talk briefly about them. First is Clark County, Springfield area. Wittenberg University, located in Springfield, is certainly contributing to the increased number of cases. And again, we see this throughout the state with colleges as students are coming back. University is reporting on its dashboard, so anybody can go look at that. The cases have increased to more than 70 this week. These cases are being associated with out-of-class social gatherings. And again, that's a common theme as we've seen in our schools. To help combat the spread, the university announced on September 9th, the classes will be remote for 2 weeks. After several weeks of being below the high incident threshold, Hamilton County is back on the list, barely, but they are back, 103 cases per 100,000. The county has seen small outbreaks in high school, college, and workplace settings, along with other sources of community spread. The University of Cincinnati is reporting 143 cases in the past 15 days, which does contribute to that. In late August, Miami County had some small workplace and church outbreaks. This week, a nursing home outbreak was identified and already has more than a dozen cases. There, Miami County is 117 per 100,000 residents in the last 2 weeks. And then we'll go up northwest Ohio again, clear up to Wood County. During the past 2 weeks, they've had 144 positive cases. Bowling Green State University has a newly developed COVID dashboard, so you can take a look at that. That reports that Bowling Green had 62 cases, Bowling Green State University, 62 cases from September 1 to September 8th. And that's the numbers. Speaking of Wittenberg, we're going to ask the president of Wittenberg to come on here, Dr. Franson. Doctor, thank you very, very much for joining us. You have a beautiful, lovely campus and with great students and faculty. And we want to just kind of find out how things are going for you and what you're seeing and how you're dealing with everything.
Well, thank you very much, Governor, for giving me a chance to share our story. As the Governor indicated, our dashboard is available at our website, wittenberg.edu/together is where our COVID information is. And together is really the description of how we've approached this as a community, how we plan to bring students back to campus, and the fact that we've just had great cooperation in Springfield from the Clark County Combined Health District and Mercy Hospital both. We saw our case numbers increase from 2, one of which was resolved last Monday, to 22. And we're doing our own contact tracing. We're finding that because of our tight-knit community, our staff who are doing the contact tracing can quickly make connections and get students to talk to them because they're comfortable and familiar. And we have a daily meeting with our combined health district and the physicians that have been advising us. And one of the things that really worried the health district in particular was they were finding from our reporting close contacts of 10 to 15 per case, whereas typically they find 2 to 3 close contacts per case. So, concerned about that. We had been doing symptomatic testing, and we're only able to start doing any asymptomatic testing middle of last week with Mercy. And to get a handle on how our community was really doing, we wanted to pause the in-person instruction and have an opportunity to test a larger swath of our community so we could really get a better picture. And fortunately, with help from the local health district, your office, Governor, we had a testing event on campus yesterday, and hopefully by the end of the week, we're going to have a better sense of where we really are.
Well, it's interesting, Mr. President, that you're doing your own tracing. That sounds like it's working pretty well. And also interesting, I wonder if you could talk a little bit more about the contacts, because and maybe explain how that tracing is done so that anybody who's watching this doesn't maybe understand the contacts. But, it is interesting. It's a pretty high number of contacts per student. So if you can kind of run through that a little bit. Sure.
So our contact tracing is being done by our staff. Our athletic trainers in particular have really stepped up to be involved in that. Their workload's a little quieter right now because we don't have intercollegiate athletics going on, and we have a lot of athletes who they know. And so we've activated them, gotten them trained to do that contact tracing, and they're very busy. And what we're finding with the contacts they're reaching out to, again, it's social circles, as the governor said. It's not spread that's happening in the classroom. It's not spread that's happening in the dining hall. It's really the residence units and social gatherings that are driving our challenges. We have about 60 houses adjacent to campus that anywhere from 3 to 5 students live in. And so we're fortunate in that, we aren't seeing spread in our dormitories. We're seeing the spread in those residential housing units, neighbors to neighbors, block to block, but not so much in our residence halls. So, we've been able to quarantine people on a smaller scale than we might if it were in our dorms.
And what's the plans going forward, Doctor? You've kind of paused. You're going remote at this point, I think you said.
Right. So we're in a 2-week pause with in-person instruction. We asked students to stay on campus as advised by your office and Dr. Fauci. I wish I could say all of them did. Some of them went home, but the majority of them are here with us. We're continuing to offer support services to students. We've got great support from the local health district in terms of taking care of our cases, and we're up to 76 active cases as of today, taking care of those students who are in quarantine, making sure they get meals, making sure we're checking up on them. And, again, the test results from this broader testing are really going to help us see if the work we were doing had captured the majority of activity on our campus, then great. But if the tests show that even with those efforts, we were missing a lot of what was going on campus, we'll have to rethink just how long we pause the in-person instruction.
We had one of your students on a Skype yesterday, Chancellor Gardner and I did, and we had students from actually all over the state. And one of the students made a kind of interesting point. The student said, what's important is that there still be stuff to do on campus, because if the university is not sponsoring things to do on campus that is in fact safe, the student's perspective was people will go off and do their own thing. So that's you got a tough balance there. You want to keep the social distancing, keep people wearing masks, but it was interesting. I hadn't really thought about that, and I don't know if you have any reaction to that or not, but I found it to be an interesting comment.
Yep, and we recognize that from last spring, that engagement was going to be really important. And last spring, as we went to all remote instruction, staying engaged with our students virtually and otherwise, keeping faculty and staff engaged. And as we brought students back to campus this fall, having opportunities for them to engage that were structured and safe was really important to us. And, we've had a couple of cornhole tournaments, which are, a good way to get people together, but keep them distanced. We've had some car races. We brought in a company that did car races on the main quad on our campus. And we've tried to do what we can to create structured activities, safe activities. We also have had a bunch of pick up and take home craft projects that seem to be a hit with students. And we've just this week had a pick up and take home cooking project. Our students who are in those houses have their own kitchens. And so, we're doing what we can. We can't do that 24/7. We have to rely on the students to mask up. What we say at Wittenberg is stay a tiger apart. Tiger's a little bit bigger than 6 feet, so we ask him to stay a tiger apart, and practice good hygiene and really limit gatherings. And what we're hearing from the health district is the distancing and masking and duration of whatever contact they have are just so important. And I think we're going to redouble the efforts to make sure students understand that. I think they've learned a lot about how important that is just from our experience over the last 10 days.
Dr. Francis, thank you, and good luck to you and students at Wittenberg and the faculty and all your team. And I've said this before, but when you see a university or college that is reporting cases, it really means that they're doing something right. They're on it. They're trying to do the tracing. They're doing the testing, and they're doing what they need to do. And the same is true. I had the opportunity to talk to the superintendent in Lima yesterday, and K through 12. And, it's just good to talk to some of the superintendents because, they're on it. And, as Dr. Franson said, what I think we're finding both in K through 12 and in our colleges is that the classroom, while there certainly can always be spread, we're not saying there can't be, but that's usually a pretty safe place. And what we're seeing is either spread out into the community, or in the case with college students, them doing something, it's not in the dorm, it's not in the class, but so those are things that we have to be concerned about. Again, Doctor, thank you. We appreciate it.
Thank you,
very much.
Governor. Appreciate your leadership on this. Appreciate Chancellor Gardner's support for all of the higher ed institutions in the state.
We appreciate it. Thanks, Doctor. This morning, I was reading Cleveland.com and came across a story which made me feel really good. And I want to kind of share it. It goes back to something that we started when I was Attorney General in 2011, when we learned that there were thousands of old, forgotten rape kits gathering dust. These kits, spanning from 1971 to 2014, had never been tested for whatever reason for DNA. That today, with what we can do today, is just unacceptable. I asked law enforcement agencies to send old kits into BCI, the State Crime Lab, which is a division of the Attorney General's office. We received over 14,000 previously untested kits. We tested each and every one of them, each kit representing a sexual assault survivor. Majority of the kits, or at least a good number of the kits, the most number, were from Cleveland. Yesterday, Cuyahoga County Prosecuting Attorney Michael O'Malley announced that his office has now indicted more than 800 people through the work of their sexual assault kit task force, which was initially formed in 2013 by then Prosecutor Tim McGinty. So we want to thank Prosecutor O'Malley, Prosecutor McGinty, and their team, the men and women of their team who have worked so very, very hard, as well as the people from BCI who have been involved in this. This is truly an amazing, amazing feat. Ohio really leads the nation in this, and something that we all should be very, very proud of. We changed, I think, by doing this, we changed the culture, or it helped advance the culture, at least in Ohio and across the country, and said, look, we're not going to accept the fact that these are old rape kits. They have not been tested. We're not going to accept the fact that these may be difficult cases to run down. And so great work, BCI, great work, our current Attorney General, Dave Yost. This has just been a real team effort. And it's something that Ohioans, I think, can be very, very proud of. And if anyone has ever talked to any of the victims, as I have, and when they tell you how important it was to get some resolution, that justice be done, it makes you feel good. And so my message is to all Ohioans, you should be proud of this, but to the team members, you're out there. Some of you are still doing this. Thank you. You don't get your name in the paper, but thank you for doing this. And I'm very, very grateful, and I know all Ohioans are. Let me go to an announcement today. We've been, as you know, looking for a new health director. And have been in the process of doing this for some time, someone to replace Dr. Acton. And today I'm announcing that Dr. Joan Duwve has agreed to serve as the director of the Ohio Department of Health. For our media, it's DUWVE, Dr. Joan Duwve. She is, I'm happy to say, a native Ohioan. She's a medical doctor. She has extensive experience in public health. She's been working for South Carolina Governor Henry McMaster as the director of public health at their Department of Health and Environmental Council. Prior to that, she served Indiana Governors Mitch Daniels, Mike Pence, and Eric Holcomb as a chief medical officer with the Indiana Department of Health and as the medical director for the department's Division of Public Health and Preparedness. Dr. Duve is a graduate of North Olmsted High School and of The Ohio State University. She won to receive a Master's of Public Health from the University of Michigan and her medical doctor degree from Johns Hopkins. Her leadership spans government and academic service. She was also an associate dean of practice for the Indiana University Richard Fairbanks School of Public Health and developed and directed the Extension for Community Healthcare Outcomes Center, which trains rural providers to treat patients with complex needs and conditions. Dr. Duve shares my passion for a lot of different things. When I looked through her resume, I just said, wow, that's spot on, spot on. These are very important things. Children's issues, many other pressing public health issues, substance use treatment and prevention. She's worked in that field, lead paint awareness and remediation, suicide prevention, smoking cessation, injury prevention. We're pleased to have Dr. Duve join. I would anticipate that she'll be starting around the 1st of October. So we think in about a month. I'm very confident in her ability. I think she'll be someone that the local health departments, 113 local health departments in our state, will be happy to get to know, and she will provide the leadership that we need. Let me turn it over now to the Lieutenant Governor. John?
Thank you, Governor. A couple of issues as it relates to the economy today, and I'll start with the census. And you may be asking, what's the census have to do with the economy? Well, this once in a decade count will determine how $1.5 trillion in federal funding is allocated to states, counties, and cities to support essential services like public education and public health. And also, as I think many of you know, it determines how many congressional districts we have, how much representation we have in the federal government at the congressional level. And as of today, 69.5% of all Ohioans have returned completed their census form. And that has us above the national rate at 65.5, but we're a little bit behind, about a point behind Michigan. So some of our other states are around us that we compete with are in the ballpark, are a little ahead of us. And the deadline's about 3 weeks away. And so we need your help. We need you to fill out your census information. It takes about 10 minutes. It has 10 years of impact if you do it. And I will just say, if you want to find this, go to 2020census.gov, 2020census.gov, or call 1-844-330-2020. And so for those of you watching out there, please share that message. For those of you in the media, please help us out. Please help remind folks that we need to get this done, that a great deal of funding that we will allocate to schools and local officials comes as a result of how we are accounting for ourselves in the census. Another piece of economic information, a little bit of good news. Initial unemployment or jobless claims fell last week. The initial, we dropped by 4%, which is good. And there were 11,442 fewer claims filed, continuing claims filed than the previous week. If you add this all up, that means that 12,178 fewer people were seeking unemployment in Ohio. All good news. We're continuing to move things in the right direction, albeit not as quickly as I know we wish. But one of the ways that we can step up the pace a little bit, if you're out there and you're struggling and you're looking for a job, go to Ohio Means Jobs. There are presently over 150,000 jobs available at ohiomeansjobs.com. More than 70,000 of those pay $50,000 or more a year. So a robust resource for you. as we continue to move forward with the economic recovery. It's one of the ways that we can help each other and help ourselves. And then a business spotlight. We've talked about some of the people that have chipped in along the way. I referenced Root Insurance on Tuesday. I would like to talk about a manufacturing company, CAM Manufacturing in Van Wert, Ohio, up off of Route 127, where I used to travel on my way home when I was traveling to Northwest Ohio. And they typically produce handbags. They cut and sew products, but they had some ups and downs during the pandemic, and they temporarily shut down, but they rebounded with the production of PPE. And CAM was able to retain their 29 employees and added 15 more. And they have already produced over 60,000 disposable isolation gowns, 15,000 reusable isolation gowns, close to 75,000 masks, and about 25,000 N95 masks. All of these things important and making sure we have adequate PPE. And we know we don't want to rely on a international supply chain. We want to build a domestic supply chain for this, also for the long run. And so what CAM Manufacturing is doing is worth highlighting. And just everyone remember this. There are a lot of businesses in Ohio that are stepping up to help all of us, and we need to support them. Support your local businesses, whether that's your restaurants, your stores, whatever it is. These are your friends and neighbors. They're part of your community. Support those businesses so that we can get this economic recovery moving even faster. Thanks, Governor.
We were going to hear from Lori Chris. I just want to say that today is World Suicide Prevention Day. And I don't know if Lori still on there, Eric? Lori, you want to just talk to us a little bit? I know this has been very, very tough for people, and I hear it all the time. I heard it from college students yesterday about how difficult this 6 months has been. I heard it from young people yesterday, college age, but I know it affects everyone. So I don't know, if Lori, if you can give us any kind of advice. Lori's been on here before, if you recall. She is a member of our cabinet, the Ohio Department of Mental Health and Addiction Services Director, Lori Chris. Lori?
Good afternoon, Governor. Thanks for giving us a chance to talk about mental health again today. And it is World Suicide Prevention Day today, so it's an important day for us to think about not just our mental wellness, but what actions we can take as Ohioans to prevent suicide. So just quickly, these are really stressful times, and people are definitely feeling it. And the message we want people to know is it is okay to not feel okay, but you also don't have to feel alone. I know you talked the other day about some things that all of us can do to check in on each other, whether that's a phone call or a text or meeting at a restaurant or a coffee shop for a socially distanced meal together, a handwritten card. Those are things all of us can be doing to take care of ourselves. But it's also important that each of us know and understand the risk factors and the signs of suicide. So on this World Suicide Prevention Day, really want to highlight that. If you have a loved one, a friend who is talking about feeling hopeless or like they're a burden to others, or they really don't have a reason to live, that's something to pay close attention to. If you see them using drugs or alcohol and taking real risks and having risky behaviors like driving in risky ways or drinking to intoxication, those are things that acting recklessly. Visiting or calling people to say goodbye or giving away prized possessions to people, those are all signs that someone might be thinking about suicide. And then also just withdrawing from family and friends, disconnecting, not spending that time that they normally would interacting with people. It can be uncomfortable to talk to someone about suicide or to talk about mental health in general, and that's normal. But just remember, talking about mental health doesn't have to be a big deal. You can just ask how someone's feeling and be a good listener. Talking about suicide does not mean that you're putting the idea of suicide in someone's mind. It doesn't make them think about it. if they already weren't. And so just talking about it, making it a conversation that's safe to have is a good thing to do. And also remembering that suicidal feelings are temporary. And so having that conversation, checking in on someone is an important way that we can each take a step to save a life. Remind the person they're not alone, and know that you're not alone either. There are ways that all of us can connect to professionals for advice and for help and for counseling and for crisis support. So just a couple of quick ways that we can do that as Ohioans. First, we have the crisis text line. So you can see that up here. It's text the number 4 and the word hope to 741-741. And within minutes, you can start a text conversation with a professional counselor who will help walk through some of the emotional distress you're feeling and help connect you to the information or support that you need. You can also call the Ohio Care Line. This is something that we started in April. It's a person on the other end of the phone, 24 hours a day, 7 days a week. And it gives every Ohioan a free, confidential way to just reach out and get questions answered, ask for help. We've already had nearly 2,500 Ohioans use this care line. About 50% of them have gotten information or referral to support in their local communities. About 30% of them have actually had a brief counseling opportunity while they were on the phone. Less than 10 minutes, but just some advice and some opportunity to ease that emotional distress. And nearly 150 Ohioans use this line as a way to get connected to crisis services because they were really seeking that out when they made that call. So we want you to use this. The number is 1-800-720-9616. And again, it's free, it's confidential, it's 24 hours a day for any Ohioan, any age, to call and ask for help. Suicide is something that occurs at every age for Ohioans. Men are 4 times more likely to attempt or complete a suicide, and that's men of all ages. So really thinking 35 and older, even older adults. So pay attention to one another and ask how people are doing, reach out for help and connect to these resources. Suicide is preventable, there's hope, and together we can prevent suicides in Ohio.
Director, thank you. Thank you very much. Very, very helpful. Appreciate it. Thanks for your good work and your department's work. We'll go now to questions.
First question today is from Jeff Reddick at WSYX in Columbus.
Good afternoon, Governor.
Jeff.
The data for Franklin County is interesting today. The cases, as you know, continue to march very upward, now over 158 per 100,000. At the same time, hospitalizations continue to go down, deaths continue to go down. That's even as we're poised to hit a higher peak than we've ever hit here in Franklin County and in Columbus. So at some point, knowing that young people are driving this, does anything become more targeted based on age group rather than mask orders for everyone, restrictions for every restaurant? Do we have a realization that young people are driving this and they're just not getting as sick?
Well, I think that's true. It's particularly true in a county that's a young county based on population. It's a city. Columbus is a young city, obviously driven by our universities. So that should not surprise. The numbers I showed up here were statewide numbers, but as you could see, huge number between 0 and 30. But big number between 18 and 30. So no, that it should not surprise us that the concern. We have a lot of concerns. It's not as if a young person can't get sick. We saw some hospitalization numbers up there. So people can get sick at any age. They can end up going to the hospital. It's less when you're 18 or 20. But we've also had examples of people get very, very, very sick. The second point, though, is the spread. And this is why when we look at our colleges and universities, and it's why the White House experts are saying, once you start back in college, don't send the students home. because all you're doing is then, taking that spread and sending it out to whoever they came from, and you may hit other vulnerable populations. So I think, a big concern is other vulnerable populations. And that 20-year-old can have it and maybe not have, not have any symptoms, but then somebody else gets it from them. So it's kind of the rebound effect. I made that up, but it's sort of a bounce off effect. And that's, really what you're concerned about. Your question is, can you target this group anymore? Yeah, I mean, that's the question that we ask ourselves, and we're looking for, we're looking for ideas and certainly ways to do that.
Next question is from Jackie Borchert at the Cincinnati Enquirer.
Good afternoon, Governor. Experts keep saying that if we really want to slow down the spread, we need to be able to test frequently and quickly. It's been more than a month since that 6-state compact to acquire antigen tests was announced. I know the feds are sending antigen tests to nursing homes and assisted living centers. Is Ohio moving forward to acquire antigen tests and use them? What is the plan at this point?
Well, we're exploring a lot of different things. I can give you next time a full report of all the different things that are we are looking at and the process that we're in. As you know, one of the big announcements was from the White House, a huge number. We're going to find out in the next couple of days, we think, when all those are coming. Those are quicker tests, less invasive tests, and we're going to make decisions about where to deploy those. When you look at where to deploy them, you look at your most vulnerable populations. First of all, where your deaths are occurring, or where the majority of deaths are occurring. You look at nursing homes, other congregate care settings. You'd also look at your universities. You'd look at schools. So all those things are coming. But I will on Tuesday kind of give you a report. We may have one of our testing experts that we have kind of walk everybody through exactly, Jackie, where we are with all the different testing. I was on the phone with our testing team this morning. I'm on the phone with them about every day, but they're better able to give you a more precise and accurate where we are with every level of that. So we'll do that. We'll try to do that on Tuesday.
Thanks. Do you have an update from my Tuesday question about the school order?
What was the question? Sorry.
Well, the order makes it optional for schools to do any sort of public reporting, like a dashboard. You mentioned the college dashboard several times today and how useful they are. But in the state health order for K-12 schools, that is something they are encouraged to do, but not required to do. So my question from Tuesday was, why not make that a requirement?
Yeah, I mean, I've talked to superintendents in the last several days who are concerned that we're disclosing too much information and that it might be too burdensome. So we're trying to get a sweet spot there. I think it's great when schools set up a place where anybody can go at any time and look and see what exactly is going on in that school. But we're trying to get this right. We think we've got the right order, but frankly, we're going to see how this works out. We're going to wait another few days and reevaluate it. We have, as I said, we have some people say you're putting out too much information. Some people said, it's too burdensome to put all this information out. What we thought was the most important thing is that if you have a child in that school and that child came in contact with the person who has COVID, you need to know that. Obviously, the normal tracing. The health department needs to know that. That report needs to be made. We think it's also important that that school disclose if there is COVID in that building, and if there's COVID in that school system. So, they are to make those disclosures. Some of them have decided to do it through a dashboard, and again, that we think is a pretty good way to do it. So, we're in a trial period. We're going to see how this works. We're going to see if information is flowing. But again, I know that in the news media, you want to get all this, and I fully understand that. The most important people that get it are the parents and the parents who have kids in that school. And our order makes sure that the parents who have kids in that school know about that and know what's going on. One thing that's been expressed to me is, look, it makes our school look bad. And let me just say again, schools that are reporting COVID should not be considered as being bad schools or not doing their job. It means they are doing their job. They're finding the COVID, they're reporting it, they're tracing, they're turning it over to the health department. They're doing what needs to be done. That's true with our colleges, and that's true with K through 12 as well.
Thank you.
Next question is from Jack Windsor at WMFD in Mansfield.
Hey,
Hi,
Jack.
Governor. Hello. First, thank you for taking the time today to distinguish the difference between deaths reported and actual deaths that occurred in the past 24 hours, as well as the scale on the graph regarding hospitalizations by age. We've already received a lot of messages, and our viewers appreciate that, so thank you. Governor, my question is regarding the New York Times article. I think you've heard about this before. It published on August 29th, and it referenced testing data gathered from Massachusetts, New York, and Nevada that found up to 90% of positive tests are picking up dead virus fragments that the CDC says could be up to 12 weeks old. That would mean that instead of maybe 15 to 20,000 active cases in Ohio, we may actually be around, say, 1,500 to 2,000. Do you have plans, or should we have plans to start tracking viral load data as a better determinant? And is it possible that we might otherwise be quarantining thousands of Ohioans and college students based on the older science and testing? And then a follow-up, where are we with the antibody testing study Dr. Acton promised back in April? Thank you.
Yeah, the antibody test, I'll let John talk about that because he has looked at that. We got preliminary results back. We've not gotten final results back yet. So when we get the final, we will certainly release those. Jack, interesting question. I don't know about the New York Times story in those states, but you know, if you had perfectly precise measurement, you might be able to, and again, I'll leave it up to the doctors, but you would have a better idea of exactly when someone is contagious. You know, the PCR, and I think I said this on Tuesday, the PCR test is very accurate, but, you know, it may be still picking up the viral, you know, well after that person is contagious. And so as we get more tests and we get the better ability to do that, you know, what everyone would love to have is knowing exactly when that person is contagious. And if there's a way to know when exactly they're no longer contagious, and that way you could confine them or separate them from people only during that period of time. But I've asked my team, and we can talk about it on Tuesday, I've asked my team to come up with, you know, exactly where the state of the art is in trying to get that viral load.
Next question is from Max Philby at the Columbus Dispatch.
Hey, Governor. Given that the symptoms of the flu and COVID-19 can sometimes be pretty similar, I suppose if more people get the flu vaccine this year, will that in any way help us avoid some of the lockdowns that we had to go through earlier this year, you think?
Well, I think that's it's a good point. I mean, it's going to enable, you know, again, I'm not the doctor, but, you know, we know a couple things, or I've been told a couple of things. One, you don't want to have the flu and COVID. I mean, you don't want to have either one, but you certainly do not want to have them, excuse me, both at the same time. And the other thing is we know that what these shots do that Fran and I just got and John got, you know, you may still get it, but you don't get it with as bad as symptoms. So the other thing that's going on, and we don't know how it's going to play out, but it's, you know, it's something to wonder about, is there have been some countries in the Southern Hemisphere that have not had as bad a flu season. And that is attributed, at least in the articles I read, to people wearing masks. Because the good news is, and we actually, Dr. Acton and I started talking about this early on, 6 months ago. But the good news is what you do to protect yourself from flu is very similar to what you would do to protect yourself with COVID. So it's not a new message. It's not a new drill, you know, and so, you know, what happened, they think, in the Southern Hemisphere is it was a much milder flu season. because people were wearing masks and were doing all the things, the washing of the hands, et cetera. So it's a positive thing to get the flu shot, and I think there's a number of reasons why.
Next question is from Jake Zuckerman at the Ohio Capitol Journal.
Hi, Governor. In interviews in February and March with Bob Woodward of the Washington Post, President Donald Trump talked about how deadly the coronavirus is and called it more deadly than the flu. He said in these interviews, I wanted to always play it down. I still like playing it down because I don't want to create a panic. Then in public, he referred to the virus as a Democrat hoax, said it would go away on its own, and compared it to the flu. Do you believe the president misled the public about the gravity of COVID-19?
Well, first of all, look, Bob Woodward is a respected journalist, has great credibility. All I can do is talk about our communication with the White House and, what they were doing. The president made some decisions early on, to stop travel, for example. Those were decisions that he made. All I know is what I saw on TV last night in the brief time I was watching. The president said, he did not want to alarm people. So I'm going to take the president at face value. Look, our relationships, what we do every week with the White House, we had a call yesterday. Usually the vice president is on the call. Sometimes the president is on the call. And if you could see those or you could listen to those, they're very, very businesslike, no nonsense, straightforward. Let's get the job done. That has been my relationship with this administration. When we've asked them, when I called the president on a Sunday morning, he called me back and said, can we move forward on this a little quicker? But whatever we've asked them to do, they have tried to do. They haven't been able to do everything, but they have tried to do, and they've taken this very, very seriously, all the way through. And so that's been my personal relationship or my personal experience, that I have had.
Next question is from Alex Ebert at Bloomberg.
Good afternoon, Governor. Thanks for having us. Following up on that last question, the governor to the north, in a state I will not name, said today during a press conference that the greatest threat to America is actually the disinformation that President Trump has given to the American people about the virus since February. In those interviews, like the previous questioner posed, he indicates that he is downplaying the virus's potential. He's called it a fraud. He's called it a hoax since then. How has that impacted the people of Ohio? Thank you.
Well, look, I'll let people make their own judgment on that. My focus has been on Ohio. I have been, I've been accused of, gloom and doom and too many facts and too much, I've been accused as an alarmist. So look, I mean, you just have to call it like you see it. I've tried to call it like I see it in Ohio. I tried to keep Ohioans informed of what we know. We continue to learn from the virus, and I think we should keep that in mind. Hindsight is always great, whether whatever governor you're looking at or whatever president you're looking at, hindsight's great. But this virus continues to evolve and the understanding continues to evolve. I mean, this has been pointed out to me many, many times, but it's true. Early on, if you talk to the CDC and the experts, they would tell us something about that mask. Well, don't wear a mask. Well, it's abundantly clear now after doing this for 6 months and after, some research being done and observations and cases followed, that masks are huge. And so, what we have tried to do, what I've tried to do as your governor, is to give you the facts as I know them. But hindsight is always great. If we knew what we know today when this whole thing started, we would have done things different probably in Ohio too. but we did not. So we're trying to call it like we see it. We're going to continue to do that. And sometimes people don't like it, but you know, I think that's what I owe the people of Ohio.
Governor, I just wanted to
Hey, John.
respond on the antibody testing. The promise has always been that it would be here sometime by the final report would be issued by the middle of September. We're still on track with that. So maybe by next Thursday or the following Tuesday, we should have that report available for presentation.
Great. Thank you.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you for being here. As we get closer and closer to senior centers reopening, we're getting quite a few of the recreational senior centers that are a little confused on whether or not they need to follow the guidelines set for adult daycares and longer-term senior centers, especially if they have to do COVID testing for all participants and employees. Would you be able to clarify that policy a little bit?
Yeah, we'll have Ursel on, Director McElroy on next week, and she can kind of run down that. She's been working on both of those, and she can kind of outline exactly how we hope to do this. You know, we realize that our senior centers are very, very important, but we also realize that this virus has not gone away, and so we have to have people who can keep their distance. Our senior centers, many of them have still been supplying services. The services just have been cut down, or they've been, you know, out away from the building itself, and you've seen a lot fewer people who have been able to actually come into the senior centers. But this is important for mental health. It's important for many reasons, and I'll have Director McElroy Skype in next week, and she can kind of lay out exactly where we are and where we think we're going. It would be an appropriate time to do that.
Next question is from Justin Dennis at mahoningmatters.com.
Good afternoon, Governor. We've heard from some local officials who say they must decide how to use state dispersed CARES Act funding by October 6th, and they feel that's not enough time. They also said the state was slow to disperse its CARES Act funding to localities. Do you feel the state has given localities enough time to work with this funding? And can you explain kind of what's happening behind the scenes in the state's process for dispersing those funds? And also, when can localities expect the next disbursement? And would it still carry that same October 6th deadline?
Sure. There is a bill in the legislature. It's passed one house. We expect it to pass the other house that will get the additional money out. We have taken the attitude in my administration that this money, all of it, should go out to the local communities. And we have done that. What they simply have to do is follow whatever the federal government tells them to do. We have tried through OBM to assist them in understanding what the federal requirements are and what the federal government is saying. So these are, to my knowledge, not our restrictions. These are as they come down from the federal government. You know, one of the messages that when we've talked to Senator Portman, Senator Brown, or members of the House, is we've always asked for more flexibility, and we've asked for more flexibility for the local communities to be able to, you know, make their determination about how this money should be spent. So I don't know, John, do you have anything to add on that? I know you've worked on that as well as I have. John just left for another meeting. Okay, so, but that's what we're doing, and you know, we want to get this money out. I talk to the mayors quite often this week. Yesterday had had discussion with a large number of county commissioners, today with mayors. So we know they need the money. We want to get them the money. As soon as this bill passes the legislature, I'll sign it. The rest of the money goes out.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Hi, Governor. I'm wondering if you're able to follow up about Cincinnati Police Chief Elliot Isaac's request that you no longer impose the 10 p.m. closure for bars and restaurants. I know you've now consulted with your lawyers and they've determined it's impossible to just carve Cincinnati out of that order. But do you plan to, or is there a need to work with the city in any way further to find a solution to their problem?
Sure. That's a good, excellent question, Ben. You're right. Our lawyers tell us we cannot legally cut Cincinnati out. We would do that. The mayor's requested we do that. If we could do that just for Cincinnati, we would do that. We legally cannot do that. The only other option is to change it for the whole state. We have other mayors who are adamant in telling me, please don't do that. Akron, Dayton, Columbus. We're not going to do that. But we certainly are very open to working with the mayor and with the chief if there's anything else that we can do. One thing the legislature can do is to pass our bill that goes after violent repeat offenders, goes after people who have no business having a gun, who have no legal right to have a gun. These are people who've been convicted of felonies and violent offenses before. They have no right to have a gun. We have a strong federal law in this area. We have a fairly weak Ohio law. We need to get the Ohio law up to where the federal law is. Now, the U.S. attorney will take some of these cases. These are cases where someone is picked up, they've got a gun, maybe they don't have not at that moment committing any other offense, but they've got a gun and they're a convicted felon of a violent offense. But the number of cases that the U.S. attorney can take are very limited. And so they're going to take some, and we appreciate them taking them. But I want to empower local judges, local prosecutors, local police, local sheriffs to be able to throw the book at the guy if he is in the community and he's got a gun and he's not supposed to have a gun. What you find, and these tragedies continue day after day, and every week I read some of the ones that have occurred to everyone because it just is so maddening. And you see little children who are shot. Almost inevitably, the people who pulled the trigger did not have the right to have a gun. We could have picked them up before. They could be off the streets. They could be locked up. So I just ask the legislature, please help us on this. I don't know who's against this. This protects the Second Amendment. These people don't have a right to have a gun anyway. So again, we ask our friends in the legislature to take action. This is something we can do. And we've presented the bill, and we would ask them to do that.
Next question is from John Reed at Gongor News Service.
Good afternoon, Governor.
John.
My question is, we're seeing these spikes in college towns because of students coming back to campus. How much of that is due to behavior of students or a higher prevalence of cases among students, and how much is we're finally getting kind of a broad-based, wide population surveillance test, and we're seeing a lot of people who are asymptomatic?
Well, I think it's both, probably, John. What we're seeing is human nature, and people are getting together, and college students are getting together, and experience in college for most people, it's get together and have a good time and socialize. But we know that if people don't do that carefully, that causes a significant spread. So you have 10,000, 15,000 sometimes students coming into a community that were not there a month ago. And in some cases, they're in a fairly concentrated area and they're intermixing with each other. So, it should not surprise any of us that this happens. And the burden that college presidents carry and that universities carry is to try to convince students, look, the only way you're going to have a year on campus, 9 months on campus, is if everyone, tries to do what we need to do. Wear a mask when you're out in public, keep the distance. You're also right, I think, that the schools that you're seeing the high numbers are schools that took it upon themselves and said, hey, we got to go test. If Ohio State or University of Dayton or if Miami or Wittenberg, these are 4 schools that we just talked about recently, if they weren't testing, you probably wouldn't know much, we wouldn't know that there are that many cases because, that age group, many of them have no symptoms. So I think you're right on both counts.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor. So my question is, what are your thoughts on the prospect of Ohio State suing the Big Ten over the football season being canceled? as
Well,
Attorney General Yost
Yeah.
has
Yeah, I mean, look, I don't know. This is going to be up to the Big Ten when they vote. I talked to Gene Smith, athletic director, this morning about it. He gave me a little update. I know Ohio State wants to play. I know the president wants to play. And I think they make a good argument. And the argument is that because they have the capability of testing very frequently, and not just their football players, but all the athletes, and they're testing quite extensively on campus too, with everybody. But they're testing even more with athletes because they have that ability. They can know what's going on because there's a real incentive for athletes who want a season, who want to play, and to avoid doing stupid things, as we all do, and not wearing a mask and socializing at a close proximity to each other with a lot of different people. But there's real incentive for them not to do that, to be careful. So I think that, you could look at these students, these student athletes, as being as safe as anybody on campus, or maybe more so. I think there's a pretty good argument that, it makes sense to try to have that season.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor. I wanted to talk more about the appointment of Dr. Duve. I was wondering, what kind of expectations are you going to have for her when she first starts? What things do you think might improve with a permanent director? And are you at all worried about any sort of pushback from the Senate when it comes to approving the appointment?
Well, all good questions. What are my expectations? High. She's a hard charger, and we're in the middle of a pandemic. So I'd love to have her in here right away, but she's got to give notice, and she's got to wrap up what she's doing, and that's only fair to South Carolina. I think, look, Lance Himes as acting director has done a very, very, very good job. I think it's always better to have a permanent director. It's, I think, particularly good with this director, with her deep knowledge of public health, her many, many years of experience in public health. And, she is on just, the calls I'm on every week with the vice president and the White House team. She's listening to those calls too in South Carolina. So, I mean, she's been doing, she's been immersed in this battle, just like we have been immersed in this battle. As far as a confirmation, look, I will leave that up to the Senate. I talked to the Senate President this morning, Larry Obhoff. I talked to the Speaker, Bob Cupp, and just to inform them of what our choice is. Look, she's worked for 4 administrations in Indiana, 3 in Indiana, 1 in South Carolina. So I think she's a known quantity, and I think she'll be confirmed, and I know she'll do a good job.
Governor, the next question is the last question today, and it belongs to Jim Oddie from WHIO in Dayton.
Governor, briefly, I wanted to have you address some of the frustrations that are bouncing around the legislature among your friends, especially those who are most conservative. Their constituents who say now that you continue to move the goalpost, since we're talking about college football, move the goalpost further and further down the road. They want to know, when are you going to remove the remaining restrictions here? Is this tied to some kind of a positivity rate, a number of cases, new cases per capita in a certain time frame here? What are your goals at this point, and when would they likely see some of the remaining restrictions come off?
Well, Jim, look, that's a good question. I'm asked that question a lot, not just by legislators. When I done a number of TV interviews, as you know, over the last few days, one-on-one with anchors and veteran reporters like you, and the question came up almost every time. When are you going to take the mask order off? This is the question we're getting in the newsroom. Many times the anchor would say to me. So I know that that's on people's minds. This is a fight we're in. We can't let the virus off the floor. We got it down. It's still killing people. tragically, killing people every day. Still people are getting sick every day. But we've been able to at least keep it smoldering and not flaring up. If we took off, for example, mask orders tomorrow, it'll flare up just like that. That would be a horrible disservice to the people of the state, because if we started making these changes, people would say, well, DeWine must know something. DeWine must know that this is not as bad as it was. Look, there is as much spread out there today as there has ever been during this entire period of time. So it would not be, a wise time for us to let up. I look at the sacrifices that Ohioans are making, the wearing of the mask, the keeping the distance, being careful with parties, all of these things as a price that we pay as Ohioans for freedom. So the freedom that we can go to work, freedom that we can go to a restaurant, freedom that we can go to a bar, freedom, more importantly, probably maybe than besides going to work than anything else, freedom so that our kids can go to school. So our kids can go to school. So we make those sacrifices so kids can go to school. We make those sacrifices so we can work. We make those sacrifices so that we can do all the other things that we really want to do. So look, we're not going to keep any restriction on 1 second longer than it has to be on. But I am not going to stand up here and take off restrictions or signal to the people of Ohio that this battle is over when I know it is not over. And there's no indication that it is over at all. So thank you very much. I want to thank everybody. I want to mention, we're running out of time, but I want to mention September 11th, Patriot Day. We remember today, and we'll try to do this maybe a little longer next week. But we remember today those who died on September 11th. We think about them when the United States was attacked. And we pray for them. We pray for their families. We'll see you all on Tuesday.
We now join our regularly scheduled program, already in progress.
Right in, and there he was spread out in a little glass enclosed room in the library, like it was his office. He was on the phone and he had papers, and I said, oh, this is a nice law firm. And he was like, oh, let me explain. I said, I'm done. I don't want to talk to you, and I don't want to hear what you have to say. And I left.
People lie for a lot of different reasons. I actually have a list of the main